How much longer should we subsidize drug prices for other countries? Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. With all the talk about how allegedly the U.S. is hurt by unfair trade practices, little attention is paid to a genuine abuse. Americans hugely subsidize the price people in other nations pay for their pharmaceuticals and medical devices. A study by the Rand Corporation found that prices for typical drugs here are 422% higher than in 33 other developed nations. Put another way, Americans are paying more than 5 times the price for drugs than other countries do. The U.S. creates the vast majority of new medications in the world, and the process isn't cheap. It costs $2.6 billion and 10 to 15 years of testing before a new pharmaceutical is brought to market. The actual cost of manufacturing a drug, whether solid or liquid, is small. It's the sky-high development expense that makes a prescriptive medicine so expensive. The trouble comes from the ugly fact that foreign governments refuse to pay their share of those development costs when it comes to buying our drugs. Strip away the euphemisms, and the purchasing process comes right out of Tony Soprano. If you don't sell to us at a low price, we'll seize your patents and have another company make a knockoff. This is why underpayments by foreign governments is the norm. Their bureaucrats do the buying, not the private sector. Unfortunately, critics of drug prices here in the U.S. totally miss the point. They vent their anger and frustration at pharmaceutical companies. There are certainly some bad actors in the industry, but the real problem is systemic. The answer is not imposing price controls or what is now called, quote, price caps, end quote. The Biden administration started this game by a process that will have Medicare and Medicaid effectively imposing price controls on more and more particular medicines. Regrettably, the Trump administration hasn't yet moved to support challenges to these controls in court or have Congress remove them altogether. Such controls will stifle innovation at a time when we are on the cusp of fantastic medical breakthroughs. This would be a profound tragedy, both for enabling people to live longer and enjoy a higher quality of life. Remember, the U.S. is the font of most new drugs and medical devices. And for overseas innovations, access to the U.S. market is crucial for their success. In trade negotiations, we should devise a fair formula whereby purchases made by a government entity in an economically advanced country includes a development fee. Here at home, the administration should have a thorough overhaul done by DOGE of what are called pharmaceutical benefit managers, PBMs. This should not be allowed to persist. On another crucial front, Dr. Marty Makary, the courageous and insightful new head of the Food and Drug Administration, the FDA, will be pushing the use of artificial intelligence and other tech advances to safely speed up the expensive and time-consuming drug approval process. Whether at home or in drug practices overseas, there's a lot to be done. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.